All right. Good morning, everybody. Welcome to the North Dallas Plano Career Focus Group meeting. It's Friday, October 20th, 2023. Our agenda this morning is we'll start out with success stories. We'll then have everybody put their 30-second introduction in the chat window. We'll then hit committee reports. And then our main event will be right around the top of the hour, just depending on time-wise. We may start a little bit early, just depending on what we've got to talk about today. All right, for those on Zoom, if you have any questions throughout the presentation, please just enter your questions into the chat window. That's also where you're going to be putting in your contact information, which we'll do that in just a few moments. And for those people watching on Facebook, if you have any questions or comments, please just put your questions into the comment field. We are monitoring that feed and we'll get those questions answered for you. Please note this event is being recorded and is currently live on Facebook. The recording will be on the Career DFW Facebook page and the Career USA YouTube channel for others to view in the future. By participating in this event, you give consent for your name and picture to appear. Please note that any comments you put in the Zoom chat window will not appear in the recording. And for those people on Facebook, if you put your name and contact information into the comment field, I will delete it immediately after the meeting. Well, good morning, everybody. My name is Jeff Morris. Back in 2007, I took over leading this group. The group's been around since the late 1990s. I took it over in 2007 when the prior leader of this group had landed a job. I saw there was a need, so in 2008, I started a website called careerdfw.org, a website to help those who are unemployed in the Dallas-Fort Worth area. In 2012, I launched a second website, careerusa.org, to help those around the United States. I've written a book called What I've Learned About Your Job Search That You May Not Know. It is available on Amazon, or I always have copies with me if you see me in person. And since 2017, I've been a member of the practice interview team. You'll hear more about that in just a moment. Well, we like to start the meeting off with good news. Do we have any good news to share? Anybody in here? Anybody out there? Any landings? We had donuts last week. This week, no donuts. All right. Well, we'll keep on going then. All right. What we'd like everybody to do now is open up your chat window. And in the chat window or in the comment field, give us your name, phone number, email address, position you're looking for, 2 or 3 target companies, and then hit the return key. I'm going to put all that information in an email that'll go out this afternoon with all the details. And look it over. See if you know somebody on that list. Maybe you have a contact at a company you could help somebody else out there. I also use this to update the roster. So your name will get added to the roster. And that way, if you're using this for a workforce session, when you're filling out the paperwork, we'll have a record of doing that. So please put your comments in. Scott, thanks for getting yours in first. I'll put 30 seconds on the clock. All right, if you're still typing away, please continue to type away. Let us have your contact information. For those people that are brand new, we will be sure to get you added to our roster so you'll know what's going on as we're doing other events. All right, what we want to do now is for those people that are here in the room, we want to give them an opportunity to be able to give their 30-second introduction. So let me spotlight this for everybody. Maybe that later. So you can see it. Well, you only see one person and a half a person there. So that's okay. I guess pass the mic around. Let's hear it. Well, start wherever and give us your 30-second introduction.
Good morning. My name is Patrick Rogers. I am a CFO by trade. I'm looking for my next corporate finance leadership role in a private equity portfolio company. I am focused in technology, healthcare, manufacturing, and consumer CPG primarily. But I also have a background in large corporate multinationals as well as Big Four consulting with Deloitte back in the day. So for my search. Sorry, it's my first time doing this with you guys. Contacts in private equity, be it the funds themselves or private equity executive recruiters who are very active, obviously is a target rich environment for me. And just as a sign off that you might remember me, I was actually born and raised in Mexico City. I'm Mexican. My name's in English because my dad was British. That's it. And I'm fluent in English, Spanish, and French. I actually picked up English at 14. So anyway, and I've had projects in Latin America and the UK as well. So it's no relo because I have kids in high school. That's very important, family first, but I am pretty flexible otherwise. And I'll pass it on to the next person, I guess. Pat, and my name is Patrick Rogers. Thank you.
Morning, I'm Jim Parker, electrical engineer. I have good communication skills, so I spent most of my career in technical sales and marketing, project management. Inside a company, I'm very effective at working across departmental lines to get things done because I speak the language of all the different departments. Outside the company, I can speak to any business or technology level to help the customer understand the full value of the products or services I and my company represent. I'm Jim Parker. I guess I'll come right into the camera.
Good morning, everybody. My name is William McLaughlin. I'm looking for a data analyst role, and I help do the research necessary to make sure the company's bottom line state gets improved. And I need contacts at CoreLogic and Leidos. Again, my name is William McLaughlin. Thank you very much.
My name is Tyler Bauer. I help translate technical requirements into business solutions. I help businesses cut costs through process improvement and forget what we said on Tuesday, but through process improvement and identifying and streamlining different data systems. I need contacts at Deloitte and Trend Micro, and my name is Tyler Bauer.
Good morning, everyone. My name is Chandler Kim. I'm a technology marketing and partnering executives who helps companies win more and grow faster. I'm Chandler Kim. My target company this week is Asigra, which is a Canadian company, and I can help with contacts at Nokia. Once again, my name is Chandler Kim.
All right, thank you very much. Want to just mention there are a couple websites out there that are totally free. If you know somebody who's unemployed, please let them know about Career DFW and careerusa.org. Both sites totally free. They're just there to help the anybody who's out looking for a job right now. Both websites have been totally rebuilt here over the last month. Just in time. It's sort of funny. So we just got it to version 4.4. And version 5 just came out this past week. So I'm not going to move to 5 quite yet, but it's pretty amazing. We just got it to 4 and it's already out of date. Please check it out. If you see anything wrong, anything that's not working, I've had some people send me a couple links that didn't work. Please let me know so I can get those fixed. I thought I checked everything out, but every once in a while something slips through. So if you know anybody's unemployed, please let them know about Career DFW and careerusa.org. One of the things you'll find on the Career DFW website are a bunch of calendars. And on those calendars, there's pink or job fairs, gold or special workshops, blue are those meetings that are meeting in person, purple are all those groups that are meeting online. So there's something going on, and be sure to scroll down to stuff going on after 6 o'clock because there's more events happening at nighttime. All right, let's hear about the Practice On You team. Chandler.
So one of the things that's common for all of us as job seekers is that somewhere along the way, there's going to be an interview. If you're interested in getting feedback on how you interview and potentially even ways that you can improve, a great free resource is the Practice Interview team. You can send an email to the email address that's listed there for either an opportunity that you are currently in process, or even if you're not in process, if you see a job that's similar to one that you'd like to have and would like to practice, you can also do that as well. It's a great resource to help you go through a mock interview and then get feedback on ways that you can improve. some stuff, great things to think about, and highly recommended by those who participate. So once again, Pit Crew, and just send an email there. I think it takes about a week or 10 days in order to get on the schedule. So please don't wait to the last minute, but it's a wonderful resource to help people.
Yeah, I know they were very, very busy this past week. I don't know what their schedule is next week. I do know the other thing too is that the practice interview team is also meeting in person on the first and third Wednesdays of the month. This past Wednesday, they were online. They were in person this past week. And next week we will be online only. So you do have an option if you want an in-person interview to come join us on the first and third Wednesdays of the month for an in-person interview. And also just come and watch, because you learn as much watching somebody else being interviewed as you do yourself. All right, time to hear about the Interview Success Workshop. Good morning, Walt.
Well, good morning, everyone, and welcome to Happy Friday. So what is the Interview Success Workshop and how is it different from the practice interview team? Now, I strongly recommend you do the workshop as well as the Pit Crew, because a mock panel interview is very, very good experience for you. I know one person who did my workshop several times, and he also did the Pit Crew about 7 times, landed, got the job, and said, well, that interview was really easy. So compared to all the other ones. And so why? Because he continued to practice and keep his skills sharp. So what's the difference between the Pit Crew and the Interview Success Workshop? Well, we're going to back up to the fundamentals for the workshop. We're going to learn how to sell ourselves. Everyone agrees it is a selling situation. So how do we do that? We want to move from a mindset of responding to questions to one of selling. And just what is it we're selling? Well, there's 3 pieces to that. Those components are I am, I do, I help. Who we are, what we do, our knowledge, skills, certifications, etc., and how we combine those to be of value and how we can help the company. So how we do that? Well, that's what the workshop's all about. It's very informal. I do them over Zoom. I want to do 1 or 2 people at a time. You should be registered to attend so I can get you on the schedule. That QR code will start an email to you that says, all you got to do is fill in a couple of things, how you learned about it, and your phone number. And I'll give you back some dates that I suggested are available so we can get you on the schedule. Right now, I'm into November. Looks like the 7th is going to fill quickly. And so we're on to the 14th. So be sure and sign up. Now, another big difference between the Pit Crew and the workshop is that the workshop is extremely informal. It is not a mock interview. It is a learning interview. It's where we can learn to sell, how to make ourselves stand out and differentiate from other candidates in a very positive way. So it's not one where you have to worry. It's not one that creates stress and anxiety. So we can have learning without squirming. I practiced interviewing every day. I learned a lot along the way. I got a job with an increase in pay. You can practice too. What else can I say?
Walt, thank you very, very much. It wouldn't be a Friday without hearing a nice educational poem. All right, it's time to hear about this, excuse me, this week's career tip of the week. Every week there's a brand new tip on the careerdfw.org websites. Rosanna, thank you for being with us and reading it this morning.
Good morning, Jeff. Good morning, everybody. Happy Friday. All right. This week's tip of the week is dated October the 15th, and it's avoid being eliminated during the phone interview. Well, great news. All your job search activities have paid off and you've landed a telephone interview with a prospective employer. How to avoid being eliminated during the telephone interview. 80% of human communication is body language, eye contact, facial expressions, the way you move your hands, your behaviors, the way you sit and stand, etc. And all of this missed during the phone interview conversation. Though these body language signals are missing, you still have these 3 powerful tools at your disposal: vocality, tonality, and content. Vocality. The quality and structure of your language. This includes such things as your choice of words and sentence structure, and your ability to demonstrate a solid, consistent thought process. Tonality, your enthusiasm, energy level, and word enunciation. A technique often overlooked in both telephone and face-to-face interviews is mirroring. While you must demonstrate enthusiasm, you also want to pattern the rhythm and tone of your communication with the interviewer. If the interviewer is slow and soft in his or her speech, you should mirror that. If the interviewer is fast or loud, pick up your pace and volume. Now, content. You only get one shot to avoid exclusion and the opportunity to move to round 2. And that is why you don't want to get forced into an interview that you're not prepared to have. Here is how to adequately prepare for the telephone interview, as well as how to respond and react during the interview. So by scheduling the call, you now have time to research the company and the position, learn the employer's hot buttons, and then sell them what you know they need. Tell them how you can either make them money or save them money, or both. You want to review news and other public information about the company, its website, social media channels, and you want to learn about any new product releases, awards, special recognitions, and other things. If they don't outwardly tell you who will be on the call, feel free to ask. Once you find out, do a quick LinkedIn or Google search to learn a little more about their backgrounds and then how long they have been at the company. Try to refrain from compensation questions during this round. If you are asked about your salary expectations, you can ask them what the range is that they're offering for the position. You can also say you'd like to learn more about the opportunity and the team before discussing compensation. Come prepared with 3 to 5 questions written down. You can make it a mix of company and personal questions, like what would the first 30 days in this position look like? And what has been your favorite thing about working here? Try to use positive statements like I know instead of I think. Never speak negatively of anyone or anything, a former boss, coworker, or company. Always emphasize why you would want to work for the company that you're interviewing with and not why you want to leave your current employer. And then do not try to evade any questions. If you don't answer any of the particular questions, or say so. Or they may ask about a skill or a program that you know or have, and then you can say that you are eager to learn. If something doesn't sound good to you, make a note of that, but don't argue or confront the interviewer. Close out the interview by thanking them for their time, asking about the next steps, and that you are excited about the opportunity. Avoid mention of any personal items like marital status, sexual orientation, or state of your health. And as you can see, there's significantly more involved in a telephone interview than what a typical job hunter supposes or expects. If you will follow the advice in this article, as well as do the necessary homework to adequately prepare for the telephone interview, you will brand yourself as being considerably more than just another applicant. You'll certainly be perceived as more than just another person to be excluded as quickly as possible during the initial stage of the hiring process. Indeed, you will be just that much farther along toward turning your job search into a job found. Well, again, this is the career tip of the week dated October the 15th, 2023. Avoid being eliminated during the phone interview. Have a fantastic week, everybody, or weekend, excuse me.
Yeah, Rosanna, thank you very, very much. I mean, I always say this, and I haven't said it yet today. I realized I hadn't said it yet, is that your resume, your LinkedIn profile, they're not going to get you a job. What they get you is a phone call. So how well you practice your interviewing skills, that's what's going to get you your next job. All right, come today, join us for lunch. We're gonna go to Dickey's Barbecue, 4032 Preston Road. It's north of Parker, south of Spring Creek. It's on the east side of Preston. We'll be there at 11:45, so come join us. Coming up in just a moment, Mike Chapman is with us to talk about your 2024 healthcare and insurance options for all. But I want to just mention upcoming sessions we've got coming up. Next Friday, Holly Adams will be with us to talk about how to use Chat GPT to improve your resume and cover letter. This should be a very interesting session. I know this past week I was down at a conference in Orlando, and I had one person specifically say, yeah, I just want to use Chat GPT to help, put together my cover letter and everything. And I went, well, but does it know it as well as you? So it'd be really interesting to see Holly's presentation next week. And then in 2 weeks, November 3rd, as we do the first Friday of every month, we'll do open forum. We'll talk about whatever questions you have about your job search. All right, it's time for our main event. I think many of you know Mike Chapman. I've known Mike for, 15, 18, 20 years. I don't know. It's been a long time. He has been helping job seekers and people who've been unemployed for years with healthcare options and what to do. So today he's going to talk about your 2024 healthcare insurance options for all, regardless of age. What's new, how and when, and what's new. I have what? Oh, I got what twice. Okay. So Mike, thank you for being with us, and it's all yours.
Okay. Boy, what an old photo on LinkedIn. I've got to update that. But I think I knew you when you had more hair than and had dark hair, and I certainly had more hair and dark hair. Jeff, can you see my screen? First of all,
you need to share your screen.
This will stop other screen sharing. Okay, hold on. We're going to go to this screen. Great. Now can you see?
Yes, we can.
Okay, awesome. Technology hasn't defeated me yet. Good morning, everybody. I tell you, this is a highlight of my day and my week. This is my busiest time of year, and I prepare basically all year for this. I really am passionate about what I do. I'm going to start the screen share somehow over here. Let's see if I can get it to screen share.
Just go to click on slideshow and then.
Yeah, the little doohickey, I've got to reduce the size because the little doohickey for Zoom is getting in the way. So pardon me 1 second.
At the very, very bottom there, you can hit the screen right next to the minus
yeah.
Screen one. I'll keep going over. Nope, the other way.
All right.
It's the right one, very right one. Nope, too far. Keep on, back over a little bit more to the left,
Okay. The little slide?
There's a little screen down there.
All right, geez. Here I was thinking. Yeah, okay, got it.
You need to cancel there.
Well, doggone it. I'm sorry, folks. Hold on. I promise I'll make it worth your while. Let me.
Let's get rid of that little Zoom question.
Yeah, let me see if I can get this reduced in size. And apps using your microphone. Microsoft Professional. All right. And I don't want to delete this. Doggone it. I've never had this problem before. This is a new version of Microsoft PowerPoint. So sorry, Jeff.
I think sometimes you can hit F5 and it'll go full screen.
Okay.
At least in the older versions.
Yeah. And this is Windows 11. I'm still getting used to. There we go. Awesome. F5 it is. And you can see this. This is my contact info. I am a insurance broker. This is about my third or fourth career. I lost track, but it's one I enjoy most. I'll give you a little bit of background about me in a second. This is not a solicitation, but I can tell you I know my stuff. I offer free advice or no cost advice and support to clients all across Texas and 14 other states. And it gives me a reason to get up in the morning, which I didn't have when I was a corporate rat, which is very gratifying at this point in my life. And I support my clients. I've been doing this as a medical insurance broker and a public speaker for over 20 years now, formerly a president and CEO and a corporate rat and moved my family about a dozen times. I became a single parent, raised two sons. I got them through high school and college without killing each other. Those of you that have ever been a single parent can relate, especially dads to sons. And I've managed personal and pre-existing conditions through 8 different locations and changing jobs, et cetera. And maybe that's what interested me in getting into the insurance, specifically the health insurance field, was knowing just how important that can be. I'm also one of the top 10 most connected people in DFW. And, the other thing here is empathy. I really care. Types of insurance, I'm going to go through these. If there is a type of, I don't do, property and casualty, that type of thing, but I'm licensed in most of the states that have tons of, a lot of population. And so I'm both licensed and certified with tons of insurance companies in each of these states, and just about all of them in Texas. Now, I'm assuming this slide will unfortunately resonate with a lot of you. When you're in the nurturing womb of an employer, you have the benefit usually these days of salary and benefits. And for many of you, becoming thrust into the job market in transition, unemployed, or knowing it's about to happen, oftentimes you get clues or signals, probably more times than not, that something bad is going to happen with the company or with your status. You start getting nervous. And then, sooner or later, you're offered the door, and then you start worrying about cash flow, job search, income replacement. How do you make your mortgage payment? If you have kids in school, perhaps tuition, all kinds of very serious and pressing. Let me tell you, I have been through that personally. And usually and often, healthcare and insurance is one of the last things you think about. And I want to go through that, but I want to go through some changes. What's happening in the U.S. as far as healthcare concerns is we're at a threshold. I'm going to talk about those. But first, if anybody's been to Choctaw or maybe Vegas, you might have won or lost with Lady Luck. You have the hole-in-one tournaments, which is, if I were to ever get a hole-in-one, it would be totally luck. Some people have a little bit of skill, but it's basically luck. Now, you have risk when you have a hole-in-one tournament. A lot of nonprofits will have golf outings, and they will offer a hole-in-one. You win a cash prize or bonuses or, certainly something. Often, and actually this is a Dallas-based company that founded this, you can offset that risk as the nonprofit. If somebody hits a hole-in-one, then, your nonprofit's cash is probably going to be drained. The insurance lays off that risk. So risk is covered by insurance. It reduces it reduces financial risk for a set price. Example are automotive, home, mortgage, travel insurance if you lose your luggage or have to reboard a plane. But health insurance is different. And I'm going to talk about that for a second. It reduces some financial risk, but at a really high price. And it is the most regulated, legislated, subsidized, and taxed, and just constantly turbulent type of insurance and market that you could think of, which maybe is what gravitated to me to it, because I like challenges. The other thing is having health insurance is no guarantee of health or health care. Okay, so you could have health insurance, and that doesn't mean you're going to be healthier or that you're going to have access to health care. US healthcare is different than any other country, civilized or excuse me, or uncivilized. I spent 5.5 weeks this summer learning about the Mexican healthcare system in Mexico and their public healthcare system. Only about 5 or 6% of the population has private health insurance. They have public health insurance, but they have a great healthcare system. They spend a tiny, just a fraction, like about 5% of what we spend in dollars on healthcare per capita. But our healthcare system is controlled. It's controlled by Center for Medicare Services, no matter whether it's an employer plan, Medicare, or the Affordable Care Act, or any other type of insurance. It's legislated to death at the federal and state level. It's also, healthcare is rationed, and it's going to be more rationed. And not just because of acquisitions and roll-ups, but venture capital, insurance companies, hospitals, health systems, they bought up all the private doctor practices. They pretty much bought up all the home healthcare agencies, hospice agencies. And so you have a real oligopoly. And it is that we also have a runaway inflation rate. Now, insurance, unlike health insurance, unlike other types of insurance, it does reduce some financial risk, but at a high price. But regardless of the price, it is going to be increasingly necessary to access healthcare. Try getting an appointment with a specialist if you don't have health insurance. Here's what we spend in the US. We spend more than twice any other country, $4.1 trillion, almost, and it will be next year, 20% of our gross domestic product. That is unsustainable. Now, so what does that have to do with me, and what can I do about my health care and insurance? Two different things. Access to insurance is different, or access to healthcare is different than having health insurance. And more importantly is, how can I reduce my financial and health risk and increase my access to care? Now, there's 3 or 4 things that you can control. There's others that you can't control, but here's what you can control. It's going to be increasingly more important. First of all, is to get that dream job. Don't get a job just for the sake of getting a job. Get a dream job with great benefits. You need to be putting an effort on remembering what an independent 1099 sales professional always thinks about, and that's return on your time invested. Where do you want to spend your time? What's going to get you that dream job faster, that has benefits? And stay focused, stay positive, stay active and engaged in your family, in your community, and in your particular vertical that you're known for as a professional, and stay connected with other human beings. The 3, just, and this may be worth commenting on, maybe not, but the 3 most important, or the 3 largest morbidities are cancer, heart attack, and guess what the third is? Loneliness. Okay, the person next to you may be lonely as hell. The person that's in the pew at church on Sunday or in the synagogue on Saturday may not have had a conversation with somebody, or you may not have had anything other than Zoom meetings all week long, or might not have even had a phone call. You need to find a way of staying active and staying engaged. The other thing is invest in yourself and in your family. Those of you that understand this little image, it's very significant. It's I'm trying to think that I'm having a memory lapse here, sorry, but basically it's tiny hinges can move huge doors. Do the things that are going to help you and help your healthcare. Lose weight. 60% of the people in this country are obese. Keep mentally sharp. Increase your physical activity. Be present at all times in the moment, and make 3 calls a day with other people. That helps you, it helps other people, it helps you keep connected, at least 3 calls, and be present with your family. This is as important, or maybe more important, down the road, and you're having health insurance, okay? Invest in yourself, do what you can to improve your health mentally, emotionally, and physically. Okay, the third thing, and having dealt with thousands of people over the last tens of thousands probably, everybody and even the system is the websites and everything are designed to sell cheap. Why? Because you know, people understand numbers, they understand what's coming out of their pocket, and so they want cheap and they go on the way. But the other question is, how much can you risk versus how much can you afford to spend? Never let adult kids make their own health decisions. I'll give you an example. A client friend of mine who lives overseas has an adult son who is a client, and he developed a very serious mental and emotional health issue. His son, thinking he was invincible, as most sons are in their 20s, he bought the cheapest, thinkingest thing that he could think of, or that he could find, and he was upset that he couldn't find anything less expensive. I pleaded with him to get something that was better. He didn't. So what happened? His parents had to move back to the United States. He is now in a 60-day treatment facility, private treatment facility, because the one that was in his plan's network would remind you of the hospital in One Flew Over the Cuckoo's Nest. You need to think about reducing your risk. And if you have a cheap friend or a cheap spouse, don't let cheap friends make healthcare decisions, because they'll make a mistake. Cheap does not mean you're going to be carving your risk. And then don't be too proud to ask for help. You don't know what you don't know. You don't know what could be putting your family at risk, and do what you do best. Vanity and pride, or being too proud to ask for help, whether it's for job search help, and especially for healthcare, is dangerous. It can really cost someone close to you and dear to you their life. So know the difference between advice, though, and expert advice. You get a lot of opinions from friends and neighbors based on their experience, but that's different than yours. Also, longevity. In the US, our longevity is the average longevity is actually going in the wrong direction. So why is that? A lifestyle. How do you want your life to and health to be like at age 70, 80, or 90? Life can be pretty good. My next door neighbor turned 100 2 days ago, she's great. She still drives, she has a wonderful life, but she's got the right attitude and she takes care of herself. And let me tell you, wellness, diagnosis, getting your wellness exams early, they, detect things early. And then if you develop something, manage the disease. 80% of what we spend as a country in health expenses are lifestyle related. You're accountable. You're accountable for what kind of life you're going to have when you get older. Now, here's some stuff that really sucks, but you sure as heck better know about it, okay? And this I'm going to talk about in a second, and it's directly related to your choices now. 40% of doctors, actually because of COVID, a greater percentage of nurses who've already bailed, they are going to retire in the next 4 years and they aren't being replaced. So what's happened? You're going to have less time with doctors, and technology band-aids like telemedicine or doc in a box retail locations are going to be a band-aid to justify not replacing doctors. We should have built, 24 medical colleges 30 years ago. We knew this was coming. I mean, demographically, we knew the baby boomers were going to be in their 70s and 80s in the year 2000s. Well, we didn't do it. What's going to happen is that you're going to have to be more accountable for your own health. I meant health. And all the more reason to get your wellness exams. Early diagnosis and treatment is so important. I can tell you personally, that's so important. And number two, and this is the avalanche. By 2030, there will be over 71 million people over the age of 65 or older. And that means more healthcare demand and more rationing of care than we have now. And it's already over 61 million people over the age of 61, over 65 now. What's going to happen is we're going to have, just like every other country, triage in terms of rationing care for those who are going to survive is going to be more accepted here because of the high cost. Now, the other thing about by 2030 is that over 70, because of inflation, not only in medical, but also the cost of nursing homes and long-term care, 70% of adults over the age of 65 aren't going to be able to afford housing and medical care. And let me tell you, people on fixed incomes, Social Security, they get hit the worst with inflation. I know this because I'm in the Medicare space big time, and I have a ton of clients that are in this situation. You want to take care of yourself so that you don't end up homeless. You want to have you don't want to end up unhoused, if you will, and you want to be able to have the care. The other thing that's changing is that, and this has happened, it's been a long-term trend, fewer employers are going to offer group health benefits. And the HMO model, as opposed to the PPO model, you may have always had a plan with a PPO plan, which allows you to go out of network and see doctors, but pay more. That's going by the wayside, and it has gone out of the wayside with plans through the Affordable Care Act in Texas and most other states. This entitlement mentality is going to change, and it's already changed in other countries, in the UK and Canada and Mexico. There's waiting lines, but also there's qualifications to determine who gets treated and whose life will be saved. All right, so sorry for all the negativity. It's not negativity, it's reality. So what can I do as a job seeker, and what can I learn now while I have the time to think about these things and do stuff about this and make changes, tiny little changes to move heavy doors in my life. Don't get stuck in the good old days. Oh, I can remember when the my copay was $10 and now it's $40 and I only paid $100 a month and now I'm paying for it. You know, it doesn't matter. You got to move ahead. You have to reprioritize your budget and your financial plan. And financial advisors, let me tell you, they're generally clueless about this stuff. And the other thing you need to do, and believe me, if you don't see a primary care physician like every 6 months or every 12 months now, if you don't see them in 12 months, you're no longer their primary care physician. You're going to go into the inactive list. You'll have to, if you end up in an emergency, they can't refer you to a specialist until you come up in to see him. So lock into your primary care physician and to the specialist you need. The other thing, for those of you that are thinking about moving to the country or hill country or something like that, rural healthcare is a shambles. And I would really seriously reconsider where you want to live in retirement. But most importantly, get healthier, live better. You will live better if you get healthier and get checkups. So this is the idea. We've got limited resources. We have right now unlimited wants. So we have an economizing problem. We have to make choices. In this way, how can you manage health and financial risk through insurance choices? So I'm finally going to talk about insurance. All right. Here's some key concepts going on in healthcare and insurance today. One is risk creep, higher out-of-pocket maximums. Okay. The amount of risk that you take. HMO plans, which are there are no plans that have out-of-network coverage in Texas and in most other states at healthcare.gov and state-based exchanges. And many plans have, especially Medicare plans, have separate drug deductibles. I'm going to give you an example. For 2024, unless you qualify for cost sharing subsidy, which I'll explain, your out-of-pocket maximum for a plan at healthcare.gov per person is $9,100. There is no out-of-network coverage. There's PPO plans available, Medicare Advantage PPO plans with $12,000 out-of-network, out-of-pocket maximums for Medicare. And how do you fight that? Well, I always poo-pooed these types of plans, but I've become a believer because of the risk creep that you're not, if you had someone in your family, especially kids, in cars or getting an accident, you're looking at $9,100 if you're in network. So how do you fight against that? You can fight risk creep at an affordable cost with what are called indemnity-based plans, an accident plan. That's the only way you can get out-of-network coverage except for an emergency when traveling with plans, because there are no PPO plans at healthcare.gov. Also, critical illness, or what are called hospital indemnity plans, that pay a cash benefit in the event of cancer, heart attack, stroke, multiple things, as well as if you get hospitalized in network or observation status. You also have to look at drug deductibles and what can you do. GoodRx is a great option. Mark Cuban's drug company here in town has gotten into the generic biologic business. They've expanded quite a bit over the last year and a half. Another one I want you to pencil down is CanadianMedStore.com. If you're on expensive medications like Eliquis, Januvia, the expensive ones, well, you're going to pay when you go off of an employer plan, you're starting a new deductible, you're going to pay more for those medications than you would have under an employer plan. Canadian MedStore is actually a Florida company that will, your doctor faxes in the script just like they would to CVS, or electronically sends it, and then they ship to you mail order from Canadian pharmacies, and it's legit. It'd save you a lot of money. What's the result? Lower financial and medical risk at a lower monthly cost. And it's about the only way to increase your coverage when you're out of your plan's network. Another key concept, and this is one that I call the multiple network shell game that insurance companies are using in the healthcare.gov under 65 markets. All of the insurance companies have multiple networks. There's a couple that actually have 6 networks for one individual health insurance company with different premiums based on access to care and using telemedicine or retail doc-in-a-boxes as your primary care physician that are owned by the insurance company. And how easy do you think it is to get a referral to a specialist in your time of need with those types of plans, when you might for another $30 a month or $40 a month, you might be able to get a much better network. But the systems and the insurance, the people you talk to at healthcare.gov, all the call centers, everybody else, they want to, their plans are, their technology is all driven to get you the lowest cost plan because they think that's what that's probably right. They know that's what you want, and they want to help you by giving you what you want, but you don't know what you don't know. Let me give you an example here. Telemed or local clinics, only place you can have a PCP is through Telemed, and that is owned by the insurance company. And it takes an act of God to get a referral to a specialist. How can you fight that shell game with somebody who really understands and lives, eats, and breathes these networks, who can interpret your needs and the doctors you need or should use and available networks and plans? And there's no perfect world here, because you may very well need to change a doctor or 2 doctors, and they may be important to you, but they don't accept any plan. Well, you've got to get beyond that. But you need to make sure you have access to good networks that have specialists, that have primary care physicians, and the hospitals you want. What this does, and also you don't have to have the same plan for each family member. There are ways I can, if you have one person, let's say a kid that's living in College Station or Austin, there are some great student health plans that are affordable, comprehensive, better than anything at healthcare.gov. They don't have to be on your plan. You also, even husband and wife or parent, child, you don't need to be on the same plan. There is a way I can help each of you have different plans. If one person has, let's say, diabetes or chronic medical conditions, and you want to pay more to be able to access the best providers, but the other person is relatively healthy, you can mix and match. All right, now I'm going to get more into insurance here. Those of you that have had or have been out to healthcare.gov, how much you pay is based on your age, your zip code, your household size, and your income estimate. Okay. And this is all, and unfortunately, what it has, there is no relationship to how much you use your insurance to how much you pay. Okay. So the whole idea of economic logic has gone kind of out the window. Premium and cost sharing subsidies are based on your income estimate, and that determines how much you pay, not your insurance. And it is possible to what I call finesse these estimates to maximize your cost sharing, premium subsidies, and access for children, Children's Health Insurance Program, or CHIP Medicaid for children. And at the worst, if you end up making more money, which hopefully you do, you have to pay some of that premium tax credit back. You don't have to pay the cost sharing subsidy back. but yet you can consider it like an interest-free loan. You'll have to pay it back, but there's no penalty or interest. Now, this is a key slide here, okay? If you can see my pointer here, this is where there are, and this is a sliding scale based on household size. This is how much, this is who is eligible for premium tax credits. And this is for 2024. It's based on your estimate. Last year doesn't count, 2023 doesn't count. This is based on your 2024 household income estimate. Even if your kids are working part-time jobs, if they get a 1099, you got to include all of it. So let's, for simplicity, let's take household of one. At 150% of federal poverty level and to 100% in Texas, I'm sorry, here we go, 150%. That is where you're eligible for a cost sharing subsidy. And a cost sharing subsidy is different than a premium tax credit or a premium subsidy. Everybody from 100% to 400% of the federal poverty level gets some amount of a subsidy to help pay for your premiums. But if you select a silver plan, 150% or less, you get your co-pays, your co-insurance, and your deductibles, which the co-pays for doctor visits and prescriptions, they're less expensive. The closer you get to 100% of federal poverty level, the more of a cost sharing subsidy you get. What happens if you don't make this amount? Okay, if you don't make this amount of, and this was 13 for 2023, the 100% of federal poverty level was 13,600. So it took a big jump this year, or will in 2024. If you make less than 14,580 next year as a single person household, then there is no tax credit. You can still pay full amount for the insurance, but it's hard to pay for an insurance plan and pay the full premium if your income is roughly about $1,200 a month, what you estimate for 2024. So in Texas, we did not expand Medicaid. In other states, they have. In those states at 138% or less, you and your family may be eligible for Medicaid. In Texas, only pregnant mothers, children under the age of 19, and people over the age of 65 are eligible for Medicaid. And Medicaid is a state-based program. The federal government will provide funds to the state, but they're state-based programs that will that are HMO based, and some of them are excellent, that will reduce the cost. That an example, and if you complete an application at healthcare.gov and you have 2 children under the age of 19 and your income estimate is 138% or less, then your children's application will be sent to CHIP Medicaid of Texas. And that application, they'll likely qualify for CHIP, which is a great program. Okay, they won't be on your plan, but it is a great program. It's affordable. It's got a very extensive medical network in terms of providers, and even dental network. There's some dental benefits. So don't turn up your nose at the idea of having your children on CHIP, but just know that that's how healthcare.gov works. Now, so that's the case of CHIP. At 150%, you're going to get more of a premium tax credit. You won't get cost sharing subsidy, but it's a sliding scale at 400% of the federal poverty level, depending upon your household size. It's a sliding scale. There's not money beyond these numbers. So you're going to pay more. You're going to possibly pay more than COBRA. People say, oh, COBRA is so darn expensive. I ran a website for a number of years called Cobra Busters before healthcare.gov was invented, created and passed in 2013 and introduced to the unleashed on the public in 2014, coming on 10 years. Cobra is, if you're not eligible for a premium tax credit, or it's a small premium tax credit, a plan through the Affordable Care Act may be more expensive than Cobra, and it's likely not to be as good of coverage as Cobra. So you got to keep all these things into perspective. And I'll answer questions at the end. And I put my contact. I'm not trying to solicit here, but I know my stuff. And if you have questions, feel free to call me. I will ask you if it's best to call or text me. I may not get to an email, especially during open enrollment this time of year, because I'm up every night trying to catch up on helping people, following up with people. So I may not even read your email for a day. Here's some key dates. Affordable Care Act plans through healthcare.gov for people under 65. We're, 10 days away or something. When's November 1st? Real quick. I won't see I know the changes in plans. I don't know the premiums, et cetera, but you need to enroll by December 15th or January 1st, or this should say January 15th for February 1st. So you have to enroll by January 15th for February 1st. Special enrollment periods outside of healthcare.gov. For instance, I got calls this week from people that just lost their job. Their insurance ends the end of this month. What can they do? Well, okay, I'm going to ask them for what's their household income estimate for 2023? How many people in their family? What are their dates of birth? Who are their important doctors? What's their home zip code? And then I will, it's a consultative session. Only take, I've got this down. It'll take only a few minutes of your time, but I can't do it back and forth by email. So it's important that we just talk and you'll understand it, but I'll get the information. I'll follow up and send you an email, and then we can have a conversation. I can help you make the best choice. If you need coverage for, say, November or December, and you have significant health issues, this is how you do it. Then beginning, and that's a special enrollment period. So you would be enrolling in a 2023 plan. Beginning November 1st, everybody has to requalify for the premium tax credit or cost sharing subsidies, even if you want to keep your plan. But usually the plans change every year too. So chances are, and it's a good idea to review your plan to make sure your doctors are still going to be in the network for next year, that there isn't a better plan available, that you have the right amount of protection and risk, and that you consider some of these indemnity options if you're looking at a $9,100 person per person out of pocket maximum risk or you're doing a lot of travel. Also, there is a special enrollment if your income is less than 150% of the federal poverty level, that chart I brought up. You are eligible for a special enrollment period any time of the year. And then obviously the typical things, and I wouldn't wish this on anybody: job loss, death, divorce, marriage, remarriage, birth, etc. You would qualify for a special enrollment, or also change in location, usually change in state, but oftentimes if a plan isn't offered, say, is offered in Tarrant County and you move to Denton County, well, maybe the plan you're on isn't available. That's a special enrollment period too. All right, there's a new thing. Everybody, this open enrollment period must now complete a form, and the agent has to then sign it. I've got an example here. So when you enroll, whether it's through me or somebody else, you'll have to get this form signed, and then the agent has to store it and save it for 10 years. That's a new requirement for CMS. That's something you can get out of the way right now. You can email me and just say, hey, send me the form. I'll get it to you, get it back to me. And then when November 1st rolls around, it takes a few days to look at the plans and, look at what your options are and get your 2024 income estimate and what doctors you need. And then, then you'll be all set. And the idea here is so you're not spending time and resources trying to become an expert in this field. It's taken me 20 years and I'm still learning stuff, and it changes every year. So, you may have a friend that thinks they know everything, or you may be very quantitative and like to dig deep in this stuff, but is that the best return on time invested you have? Or would it be better to spend your time working and doing what you need to do to find that dream job that offers benefits that are most likely better, less expensive because the employer subsidizes it than what you can get at healthcare.gov. I'm also heavily into the Medicare business. I'm just going to go through some basics here for those of you over 65 or approaching 65 and don't know what to do. Open enrollment period has begun. It began October 15th. It goes through December 7th for coverage beginning January 1st. You can change your Part D drug plan or Medicare Advantage plans during this period. You can also change your Medicare Advantage plans. You can't change your drug plans, but you could if you don't like it, you can change your Medicare Advantage plans from January 1st to March 31st. It's best, you start a new deductible, and so it all resets. But if you don't like it, or you find your doctor no longer accepts it, you can make a change. Just an overview. Original Medicare Part A and B is what you buy from Uncle Sam. Part A covers hospitalization, hospice, and blood. If you've worked or your spouse has worked 40 quarters, or even if you were married for 10 years and then divorced, you're eligible for Part A, okay? But the 40 quarters or 10 years is the key factor here. Also for people that have moved here from Canada or India, et cetera, they have other options that I can explain. If somebody is not eligible for Medicare, they may be in their, heck, I've got some clients that are in their 80s that aren't eligible for Medicare, but they're eligible for a plan through the Affordable Care Act. Not as good as Medicare. Medicare is it is extremely underpriced for what it provides, but it is what it is. Part B is referred to as doctors. It's part of the original Medicare that you get with your red, white, and blue Medicare card. For 2024, it'll be $174.70, except for people that are in higher income brackets, and that's a tax known as IRMAA, IRMAA. You can look it up, or you can ask me about it. That can increase the cost of Part B and your drug benefit considerably if you're a super high income person. Now, A and B cover 80% of your medical expenses, but that extra 20% sooner or later will bankrupt you. And A and B, original Medicare, you can access any doctor, any hospital in the US that accepts Medicare. And let me tell you, every hospital accepts Medicare, and still to this day, 95% of all doctors accept Medicare. Eventually, though, you're going to go broke with just A and B, and that's where you purchase private insurance to reduce the medical expense or reduce the cost of drugs. When you are eligible for it as the first of your 65th birthday month, or if you've been on disability, a long-term, been ruled disabled for 24 months, or if you're on the first of the month, like somebody on this call, then you're eligible the month before. And you can enroll. It doesn't go into effect until the first of your 65th birthday month, or if you're the first of the month baby, the month before that, then you can enroll 3 months before that. Now, more and more, and I advise this because of inflation, work as long as you can. Okay, as long as you are staying mentally sharp, somebody wants you, you're providing a good service. The longer you can work, the longer you have until you have to tap your savings. And in an inflationary environment, that's not a bad idea. But if you are working past age 65, you still want to enroll in A. Why? Because if you have a major health claim, let's say you give, and I've had this happen, clients come to me, somebody develops cancer, have heart bypass surgery, huge bill. Their insurance company, through their employer, audits the bills, finds, hey, here's somebody at 65 had a big claim. According to our plan, he's responsible or she's responsible for the portion that Part A would have covered. And if you don't have Part A, guess who's paying that bill? So you want to enroll in A no matter what, but usually Medicare plus supplemental coverage will provide you with lower health and prescription risk at lower dollars to use. So 9 times out of 10, unless you're eligible for, unless you're having to pay a lot of the IRMA tax penalty, Medicare is the best deal. Medicare special enrollment periods, too many to list, but federal emergencies, drought, fires have been huge. The blizzards, ice storms. Whenever there's a federal emergency, you can change your Medicare Advantage plan. Working past 65, if you have a loss of group health plan, or I should have put this on here, you can decide to go on to Part B at any point. Now, how you do that if you've worked past 65, it's kind of tricky. So just reach out to me if you know somebody that runs into that. Otherwise, you pay a penalty for not having signed up for B when you turn 65. But also going on to Medicare is a special enrollment period with your employer health plan. So you can decide to do that at any point you want. Medicaid eligibility, which is based on income, okay, or loss of Medicaid eligibility, that's a special enrollment. Or if your plan isn't available in the county and changing plan in another state, that's a special enrollment period. Here's some other changes. For the first time, there is a maximum on prescription drug expenses. I can't tell you the number of clients that are spending, $10,000, $20,000 a month on cancer meds. Okay, they get a lot of it, but still a big chunk is not covered by foundations. For the first time, Medicare will cap medication expenses, medications that are in the formulary, to $8,000, and this goes to $2,000 in 2025. And then there are, if you ever become Medicaid eligible, there are tons of additional benefits. Also, there's more agent compliance. There's a form that is always needed to be signed by individuals enrolling, but now you have to wait 2 days after signing that. It's called a scope of appointment form. You now can't actually enroll in two days after you enroll. And this is one I love. I have to record all phone enrollments. What used to take 10 minutes now takes about 30. So there's other ways to enroll. And the phone systems, recording systems are, they're not quite ready for prime time, but we're doing it, and it'll get better. Other changes about plans in Medicare. There's plans that will refund part of the Part B premium. There's also plans, Medicare, I'm not going to get too much into the weeds here. Medicare supplement plans go up a little bit as you get older. For people that are in their 80s, that may be $300 or $400. At that point, your Medicare supplement, which means really low out-of-pocket medical expense, what you're paying in premiums doesn't look so good, but there are now some look-alike plans that are Medicare Advantage plans that have no out-of-pocket expense. You pay more in premiums, but less than you would with the Medicare supplement plan. Good thing here, you're going to see fewer commercials with Joe Namath and other celebrities hawking Medicare in the afternoons and mornings on TV. And a big clampdown on telemarketing calls. I still get them, but not as many. And for the first time, Center for Medicare Services will be negotiating drug pricing. They've started on 10, and every year they'll do 10 or 20, and hopefully it'll reduce the ridiculous cost of some of the high cost medications. Also, all phone calls must be recorded by agents and stored for 10 years. If I live to another 10 years, which I'm sure planning to, there's a disclaimer that's required. I do not offer every plan in your area. Any information I provide is limited to those plans we do offer in your area. Please contact Medicare.gov, blah, blah, blah. So that is an overview, and hopefully it wasn't too far down in the weeds or too boring or too scary, but I wanted to give you some thoughts about what you need to do. It's so important not to be focused so much on cost when it comes to access to healthcare, especially in light of the aging baby boomer population and, just droves of nurses and doctors leaving over the next few years. Make sure you take better care of yourself, get yourself healthier, be medically sharp, focused, connected with other people, lose some weight. I'm working on it. And help somebody else and learn some new habits during this time when you have the time, rather than being so job focused. Now, to what feel free to link to connect with me. I'll be happy to, if I have a personal connection and you need an introduction and I know the person, I'll be happy to do it. But this time of year, as I said, I may not get to that LinkedIn connection for 4 or 5 days. And right now, emails, because it's the beginning of open enrollment season for Medicare, it may be a day and a half before I can respond. And that's just, that's just life. But a 5-minute phone call or text, or if you do email me, I need to have your permission to contact you and your phone number and the best time to call. I can't help you unless we talk. I got to get that information. And, 5-minute phone call is better use of your time and my time. I'll get information, like I said, 24 to 36 hours before I can respond. There's no cost for this, okay? There's no obligation. I provide advice and service to people throughout the Metroplex and in Texas and, a number of other states, Arkansas, Oklahoma, California, Florida. You don't know what you don't know. Just try to save time, focus on your job search and on your family and on what's important, on your health. I haven't scratched the surface on strategies that can help you get access to doctors, hospital and meds and save money. But, don't be cheap. I'm here when you need it. I'm the guy that gets referred to by the cancer agencies, the Heart Association, because they know I'm thorough. I do the right thing. It's a reason why Jeff knows that I do the right thing, and South Lake Focus Group and other groups. It's not about trying to make a buck. This is about me. This is my calling. I spend literally about 4 months recertifying every year with every insurance company, and then about 3 months during open enrollment, which goes through January. And I'm passionate about trying to help people, and I will to the best of my abilities, as long as I'm above ground and have most of my marbles. So I thank you. I look forward to talking to you, and I'm happy to take questions.
Mike, thank you very, very much. I mean, I think for most people are going to say, yes, this is just overwhelming. And it really, truly is overwhelming. I just recently jumped on to Medicare. I'm the 1st of the month person he was mentioning. So my Medicare got to kick in a month early, but it's like all the little things and, which healthcare plan. I mean, Mike is really good about giving the details. He punches it in. I guess you've got something that sort of tells you what works, and he'll come back and show you, here's 5 different plans, here's why you should take this plan over this plan. He's got the cost all laid out and everything. So if you've got an insurance question, feel free to reach out to Mike. I mean, before the Affordable Care Act, And Cobra, Mike was always pushing, don't stay on Cobra because there's better options. Well, nowadays, as Mike said, Cobra may be the better option to stay on. I saw, you got a question, Walt? I saw you grab the mic. All right, we got it.
Hi, Mike, Walt Glass. Good to see you
Hey,
again.
Walt, good to see you, bye.
Yeah, I'll be calling you again.
Okay, please do.
There's a little known thing that I found out, and I may have mentioned it in past, that only applies to people over 65 and I'm losing a job and want to take Cobra. This occurred to me about 8 years ago. And claims were being paid okay under Cobra. Then all of a sudden I got these very, very small amounts. The bottom line was, if you are even eligible for Medicare, Cobra is only going to pay you what Medicare would pay you.
That's right.
Was that my Cobra was about twice as expensive as my Medicare costs. And they never said anything about it. And I said, well, why didn't you tell me that? He said, well, if you'd have asked us, we'd have told you. So it wasn't, and there was not in any of the material, there's no information. Is that still true?
Yeah, and also, like I said, if you don't have Part A and you're on Cobra or on your group health plan, you're asking for trouble.
Okay, hold on a second. Sally, I see you got your hand up. You want to ask the next question?
Yes, thank you. Hi, Mike.
Hi, Sally.
I'm under under age 65 and on Cobra, and most likely it will, if I don't get another job before the end of the year, it will end on December 31st. Is my enrollment period right now for looking, and Cobra was the cheaper option versus the healthcare marketplace. And I do have some experience in benefits because I've HR for 25 plus years.
Yeah, first of all, let me address the last thing. This market, the rules and regulations change every year, and healthcare.gov is so different every year. You have your coverage ending December 31st. You'd have a special enrollment period of 60 days.
Okay.
But you could enroll either under that special enrollment period or during open enrollment for November 1st. And it will be based on your 2024 household income estimate, your household size, age, zip code, etc.
Okay, great. Thank you.
Sure. Hey, Jeff.
Yeah. Hey, Mike, got a question for you. You said, okay, I'm currently on marketplace insurance. After I lost my, got on that back in March timeframe. You mentioned something about we have to call up and renew that subsidy when they say they get, did I understand you correctly?
Yeah, each year you have to, even if the plan doesn't change, you have to requalify, go on to health, you have to go through the premium income tax credit portion. You will most likely, if your insurance company hasn't, you probably get an email saying, fill this out, or, they'll direct you to the right page. But it's also a good idea to see it's like a doctor checkup. Are your doctors going to be a network? Is there a better plan available? Has your plan changed, significantly? Because the plans will change every year.
Okay. So basically I can just go on the website and try to, and there's a link for me to requalify, or do I wait for my insurance company to send me for Blue Cross to send something to tell me that?
Yeah, Blue Cross isn't very up to snuff, and oftentimes that stuff gets lost. I mean, you've got plenty of time, so don't stress. One way or the other, you can get it done in November. You can't do anything right now anyways, Jeff. So
okay.
Just put a tickler on your calendar for 2 or 3, 4 weeks from now, or call me and we'll go from there.
All right. Thank you, Mike. And I'll let everybody know I've worked with Mike before. I'm getting temporary insurance and stuff between when you transition or transition out. And it's really helpful. Thank you, Mike.
You bet.
Great, thanks, Jeff. I had a question here in the room. Yes.
Yes, I thank you for the great information, Mike. I just was wondering if you could talk for just a minute about like Christian bill sharing programs and, as an alternative or a complement, or, what you see going on there, because I've looked into that and it's a very interesting landscape. It's a very different way of thinking about risk. And I think a lot of it for me as a finance guy has to do with carving out moral hazard. So for example, if I get in a wreck and I get a DWI, I don't get to participate in the bill sharing or anything like that. So it actually makes you, from a moral hazard perspective, it makes you behave much better, which is a way of essentially curing society of its ills, because to your point, people are not losing weight. The standard American diet is basically killing everybody slowly. I mean, we live in the deck is stacked against us. But the interesting thing I find behaviorally about these Christian care ministries, Medishare, et cetera, is by doing that, by carving out those bad choices, they are improving people's tendencies, lifestyles, et cetera. And it attracts people, and you're putting yourself in a pool of risk that is healthier and better. Therefore, the household share is considerably lower than you would pay for a monthly insurance, where people have zero incentive.
Yeah, I can tell you, I was on Medishare for 4 or 5 years. Okay. I didn't qualify for premium tax credit. I will tell you that now the premium tax credits are so much better than when I was on it. I mean, they're substantial. But what you say is valid, but those plans do not cover wellness exams. Okay, so let me tell you what Mr. Cheapo here did. And I'm the first to admit I'm the cheapest, tightest wad going. I didn't get my wellness exams. I turned 65. One of the benefits of turning 65, a Medicare benefit, Part B benefit, is you get a once per lifetime soup to nuts welcome to Medicare physical. Found out I had prostate cancer. Okay, so a year later, a few months later, right as COVID was getting going, I'm having prostate cancer. And that's really that it has affected my life. I mean, I'm above ground. 3 years later, it's still, and it was pretty significant. So I'm at risk of that in the future, and it's the second leading cause of death in the U.S. The thing that disturbs me is based on my personal experience, and that is that you got to get those diagnostics, and guys are the worst. Right, ladies? Those of you that have husbands or boyfriends know that guys hate seeing doctors. We all still think we're 20 years old and are going to live forever. Well, it severely impacted my life. I'm blessed to be doing what I'm doing. I plan to do it for a long time, but I put my life and my lifestyle at risk as a result of not wanting to of looking to save money and reducing the risk, and having not qualified for premium tax credit, but not having the ability to get a prostate exam, a mammogram, pap smear, colorectal exam. It costs lives.
Okay, thank you very much. Just a very quick follow-up. I actually get blood work done every quarter, every 6 months, and I'm very much on top of my health and exercise, et cetera. I'm just saying, assuming one checks those boxes, and you look at this over here, but fine, you spend a couple of $100 a year getting blood work done, et cetera, and just cover that yourself, which at the end of the day, going through insurance, having the copays and the back and forth and all the administrative cost and load involved in that, it costs a lot of time. And at the end of the day, you end up saving very little to no money. Really taking a total cost picture of one's own healthcare in that sense. Is there a study out there or any reference that you would be able to point us to where we can go and look at some different case studies to see what is the true cost of healthcare, to put the complete picture together? the risk, the lifestyle, all these things with different plans. I know it's a very loaded question, but you have to your point, cheaping out on your physicals and things. Fine. Let's assume you don't do that. You actually are self-compliant and you take care of yourself, right? You manage the risk as well. Is there has someone done an overall study that really assumes not best case scenario, but really total responsibility and compliance and looks at what that math looks like?
Well, I can tell you that you're the unicorn, having helped tens of thousands of people.
Okay.
Very few people want to spend the money or the time to keep up on that. Women do tons more than men do. And with higher premium tax credits today, oftentimes the plans are available, especially if your income, based on that chart, the economic incentive of a plan through Medishare or similar Christian healthcare sharing system, plus what it costs, not only for blood work, but mammogram, pap, colonoscopy, prostate exam, that even if you get that in network, I don't know that there might be an advantage, and I wouldn't believe any study that's ever been done, but I can tell you, human nature being what it is, people don't do it. They should, but they don't do it. And I'm the perfect poster child for that.
Okay. Thank you.
Paul Gordon, you've got a question. You got your hand up.
Yeah, thank you. And thanks for the very interesting and informative back and forth we're having here. I don't want to pile on what the previous gentleman was talking about, but I'm also considering, one of these share networks. And I looked at it just from a financial standpoint. I've traditionally had high deductible plans. So if I'm going in, getting stuff done, I'm paying for it anyway. So I don't see from a financial basis that it's an impact to me if I'm going to just go in and get blood work done and pay for it out of pocket. Okay, fine. What are the other maybe holes in using one of these plans? I mean, I go to a different state. Is it going to be an issue? I know that they don't cover some pre-existing conditions. I mean, it seems like there's a lot of front end work that you got to gather up all the receipts. You better have the money to cash flow these payments because it's going to take you 60 days to get the money back. Again, I'm prepared to do that because the savings is so significant, but are there any other blind spots that we need to be aware of if using one of these programs? And thank you.
I mean, they even have an adoption benefit. So there's the maternity benefit is not, maybe what you would have in a insurance plan, but you have access to a nationwide PPO network and a telemed benefit, so it's 6 of 1, and I represent those companies. But what I do, I share my personal story and help people understand that it's not just about you two guys, you're the exception. Most people in this, they especially, they're looking at how can I save $100 a month, not what I can do to make sure I'm still around in 5 years with the quality of life I want. So that's where I'm going to be. I want to make, even though I did it and I see the benefit of it, I want to make sure that so you can make a knowing decision.
All right, thank you very much. Appreciate it.
Sure.
Thank you, Paul. Kathy, you've got your hand up.
I do. Are you telling me that I must have a mammogram and I must have a pap to be involved, to participate in these programs?
No, I'm saying they're not covered with you can get the network negotiated rate with the Christian Healthcare Sharing Ministry program, but they're not quote unquote free. Okay. They are a benefit, a wellness benefit that is, if it's diagnostic or wellness based within the guidelines of every 5 years or 10 years for colonoscopy or mammogram SMAP, then it doesn't cost you anything. And dollars and cents is what drives people's decision. If you have to pay $100 to, and it's a lot more than $100, it may be $1,000 for a colonoscopy in network, or it's covered. Those are the types of things that are going to keep you healthy and maintain your quality of life longer, and keep you above ground longer.
I
if you
totally
get-
disagree with that statement. Okay.
Okay,
Mammograms cause cancer. I will never have another mammogram, pap smear, and I'll never have a colonoscopy because I know too many people that have, wow, they got their colon nicked because somebody's just learning how to do this. And it causes serious problems.
yeah, I can only tell you, from a standpoint of, there's pluses and minuses for everything. I've got, as a healthcare advocate, okay, in addition to insurance, I got to let people, I don't push people into a plan. I want them to make a knowing decision. You have made a knowing decision based on your beliefs, and I respect
No, it's
that.
based on research. Okay. It is not, it's not just that I believe this stuff. I have researched it and I'm with Paul. I don't do this stuff. I try to keep myself healthy.
Good. That's the key.
I don't understand why I should have to pay for those things if I'm never going to use them. That's my first thing. But you're telling me that I don't have to. Is that correct?
Oh,
That they're
sure.
not
No,
required.
they're not optional. It's just that they're at no cost through a plan through the Affordable Care. There's nobody forcing you to do that.
Okay, well, I don't think it's long before they do. I wanted to share something else. I participate in a lot of health calls as part of keeping myself healthy. And I heard something profound this week, and that was, if you want to make sure you can do something at, pick a number, 55, 65, 75, do it every day now. And if you really want to make sure, do twice that much every day now, because we're all going to suffer a bit from aging, no matter what we do. And honestly, as simple as that is, it blew me away. Heck yes, I need to be doing it every day now if I want to be doing it at 75, So I just wanted to share that with everybody.
Thank you.
Yeah, you talk about being overweight and this country overweight. I was in Orlando last week, Epcot on Sunday. I have never seen so many big people. I mean, big, giant, unbelievable. And they're all in those little motorized carts where they should be up walking around. But yeah, very amazing. Mark, I see you've got your hand up.
Yeah, my question relates to the healthcare.gov side of things. I'm about to be laid off. I know that for a fact because I've been told that. The job that that I currently have until it goes is it's a VP position. So it pays a fairly good salary. Now, November the 1st, that stops. And I've been looking at the healthcare.gov, and as soon as I put my salary in for this year, my earnings for this year, income, it blows the numbers off the screen, basically. How do you normally manage that? Is it a forward projection, or is it based on what your WT is going to say?
Yeah, let me explain that, Mark. If you need, you're going to have a COBRA option, okay?
Yeah.
So if you would get severance in 2023 tax year,
right,
just go on a COBRA. Next year, your income, and make sure you get all the money coming this calendar year.
Okay.
For 2024, your household income estimate will not have any kind of a package in it. It will have unemployment. It'll have, other forms of taxable income. Use that. So try to get what you can in this calendar year, and then redo the numbers once it's available in 2024.
Okay, so the qualifying event then would be the fact that I drop COBRA. Is that the time that I apply for the healthcare.gov?
Yeah,
Do that now during enrollment?
No, well, you can enroll in November for November 1st. We can talk offline about it, but
okay.
The timing of when you take any package, bonus package, or stay package, or whatever is offered, or even the income. Another thing is, take the income that you need for 2024, take
Right.
that in 2023, so that you have very low income to report in 2024 and
Okay,
base your estimate for 2024 plan on that.
okay, thank you.
Sure.
Great. Question here. Yes. Who's got the mic? Where'd the mic go? Oh, come on, Walt. You're in charge of the mic. Here you go. Pass it along.
I've had my Plan B changed during the time, which time I've had it, and I would like to speak with you about options. But one of the things when I was trying to move forward is I was told that because my primary healthcare provider that I've had for 30 years has never taken Medicare, could not be a referral to other specialists who do take Medicare. They would not honor that referral. And that was brand new. And then having another provider that did take Medicare drop the Medicare after I selected the program based that they were part of it. So it's sort of an interesting kind of situation. But I would like to speak with you. Did you say the best way is phone call or did
Yeah, phone call or text, because I may not even see your message till Sunday night or something, just because I'm backed up. But to answer your question, it sounds to me like you had an HMO Medicare Advantage plan. And with those, just like the HMO plans for people under 65, you need a referral to see a specialist. If your doctor's not in the network, then you're out of luck. With a PPO plan, you don't need, you can pick up the phone and call an in-network provider, or you can pay more with an out-of-network provider. So it really, you really got to get down on the weeds to make sure that you're in the right type of plan. If your doctor doesn't accept Medicare, then you're okay as long as you've got the right type of plan. Or Medicare supplement plan, doctors generally like those because they're reimbursed at a higher rate. But most people, and I'm talking a generality, yeah, but a lot of people just, they base their information on what they see on TV or friends and relatives. And that I can help, I go out of my way to help people understand the difference so that they can make a knowing decision.
I was also told that that when my one provider chose in February not to be in part of my plan, which I thought was a PPO plan, that would be okay because the being an out of network provider, I would be reimbursed for some of those costs. Then I got a letter from the Plan B provider who said they would not pay for any out of network costs. And that happened during the time, recently. So it's not like you can leave the plan. You have to wait till now. I thought that was interesting.
Yeah, and we probably should talk because Medicare Part B is something that you purchase from Uncle Sam. You'd have either a Medicare supplement plan or a Medicare Advantage plan over 65. And I'll help you go through it and drill down so that you understand the differences.
Thank you. Appreciate it. I'll text.
All right.
Any other questions for Mike?
Mike, first of all, do you see any trend in the number of doctors that accept Medicare?
Well, it's right about 95% accept Medicare, but I will tell you that a lot of I wouldn't say a lot, a percentage, even 1% is a ton of doctors, right? But there are doctors that are going concierge. I see a concierge doctor because I don't want to, if I have a medical emergency, I don't want to wait 3 months to see, to get in to see a particular specialist. So there are, more doctors going the concierge route so that they don't have to deal with the BS of insurance companies, and they get to spend more time practicing medicine and they make a decent living. There are also doctors that are part of a big practice that has the software and technology to make more money with that practice through Medicare Advantage plans, but it's still like 95% except Medicare.
Thanks, Mike.
Jeff.
I got another question, Mike.
Mhm.
My wife's gonna be 65 in July of next year,
Uh-huh.
24. You said 3 months. You start enrolling for that stuff 3 months for Medicare stuff at 3 months before that her birthday, or is that?
Yeah, I'm sorry, Jeff, I don't recall your wife's name, but just have her reach out to me because I've got to complete, there's so many gotchas about Medicare that people don't understand. But you can enroll, to answer your question, Medicare Part A and Part B, you can enroll in 3 months before the first of your 65th birthday month, unless you were born on the first of the month, and then you enroll a month earlier. And that's the earliest. You want to do it early, you can do it later, but if you do it early, then you're guaranteed to get your Medicare card in time and can get supplemental coverage.
Yeah, I
Okay.
would put a date calendar 3 months before and get signed up, because I know it took Medicare, it was probably 2 months, 2 of that 3 months for them to finally approve me or finally get the approval, and the card came in like a week before theoretically the date would start. So just put it on your calendar and knock it out on that 3 months before.
Thank you.
Anybody else? Any other questions? All right. Well, Mike, thank you very, very much. I'll put
Thanks,
your
Jeff.
back in the email I put out this afternoon to everybody. So if you want to reach out to Mike, you're able to do it. He prefers a phone call, which you may or not answer, but at least it'll go to voicemail for you, or text message. It's the best way to reach out to Mike.
Yeah, and I'm real good about returning phone calls as soon as I'm off the phone. And text messages, it's just the emails that take some time.
And this is his busy time now through, right?
Yeah.
Busy time now. All right. Well, Mike, thank you very, very much. All right. Let me just share a few more slides. We'll get out of here today. Next Friday, our speaker will be Holly Adams. She'll talk about how to use GPT to improve your resume and cover letter. Should be an interesting presentation. If you have not put your information in the chat window so we can get an email to you this afternoon and add you to the roster, please do so. Just give us your name, phone, email address, position you're looking for, 2 or 3 target companies, and then hit the return key. Those 2 or 3 target companies, those are the key to trying to find your next job. All right, Career FW and Career USA, we're putting on training 4 days. Please join us next Tuesday. Locke Alderson will be with us for LinkedIn Tuesdays to talk about how to use LinkedIn for job hunting, strategies to get results. Next Wednesday, you'll be able to watch an actual practice interview live online. It'll be on Zoom only. There'll be no Facebook, and we will not be recording it. We only record it for the candidates. They can go back and watch it at their convenience. And then next Thursday, being the 4th Thursday of the month, we'll talk all about networking. Every session, we've got a different speaker who shares their thoughts on networking. Hey, networking is basically the same thing. It's reaching out to other people, but everybody has a little bit different method on how they do that. So join us for that. This session has been recorded. You will be able to see it on the Career DFW Facebook page or the Career USA YouTube channel. On the Career USA YouTube channel, click on playlist, pick the list you want, and at the very bottom where you see that red circle, view full playlist, up will come a list of all the dates and topics. And just remember, when you're looking at the North Dallas sessions, that those talks and speakers talks start about 25 to 30 minutes into the recording. Join us today for lunch. We're gonna go to Dickey's Barbecue, 4032 Preston Road. We'll be there at 11:45. Oh, I don't know, 11:45 got real small. And just north of Parker on Preston, south of Spring Creek. It's on the east side of the road. Come join us today. And we'll socialize and get to know everybody a little bit better. So thank you for joining us today, everybody. Have a great weekend, and we will see you next week. Mike, thanks again.
Thank you, Jeff.